figure out how to turn my camera on. So I'm doing this live stream. Um, I wanted to talk about psychiatric drugs today in their different classifications. I'm not a doctor. I don't claim to be a doctor or a pharmacist. My information is purely for educational purposes, and I'm just going through the general drugs as I understand them and that I have taken over the years. Um, there's three basic types of psychiatric drugs: antipsychotic drugs, anti-anxiety, and antidepressants. Um, Starting with antidepressants. Antidepressants were first made, I believe, in the 1950s. The first class of drugs was known as MAOI inhibitors. They were the first antidepressants. They're not used very much today because they can interact with certain foods that can cause death, like grapefruit juice, wine, and some cheeses. And there are other foods you can't take with MAOI inhibitors. So it makes it very complicated and dangerous to try to prescribe those drugs, and many psychiatrists simply don't do that anymore. Another class of antidepressants that came later was called tricyclic antidepressants. They've been around for a while, at least since the 1970s, if not earlier. They're safer than MAO inhibitors. They don't have any food reactions, and they're about equally effective as MAOI inhibitors. MAOI inhibitors are very effective as antidepressants, but as I stated, they're dangerous to prescribe. Tricyclic antidepressants do not need a food restriction of any kind. There's no food reactions that would come from taking the drug. Another class of drugs is anti-anxiety drugs, and that's pretty broad, but I'm specifically meaning benzodiazepine drugs like Valium, Librium, Xanax, Klonopin, and other drugs like those, Ativan. These drugs are used for anxiety, but they are physically addictive. If you take them over time, you need to increase the dosage to get the same original effect you had when you first started them, and you would need more and more of the medication. And if you abruptly stop, you're going to go through a nightmarish withdrawal. So most doctors and psychiatrists are very wary of prescribing benzodiazepines for long periods of time, because if you use them past 4 weeks, you can have really bad withdrawal that's even life-threatening if you have seizures. So many doctors, including my own, don't prescribe benzodiazepine tranquilizers. They're effective, but they should only be used if used at all for short periods of time, or no later than 4 weeks. But even then, I know people who have gone through withdrawal, really bad withdrawal, when they stopped after 4 weeks. Another class of drugs is antipsychotic drugs. Antipsychotic drugs have newer and older drugs. The older drugs are called typical antipsychotics, and they include Thorazine, Haldol, Nalvain, and a few others. These drugs are not addictive in the same sense as the anti-anxiety drugs. They're meant to treat hearing voices, hallucinations, delusions, paranoia, just the general problems that come with being psychotic. Antipsychotic agents include newer antipsychotics called atypical antipsychotics, like Seroquel and Zyprexa, among others. They work with less side effects than the original antipsychotic drugs. There's some symptoms known as tardive dyskinesia, where you get permanent body movements, like moving your head, and your mouth just keeps opening and closing, or you get a tremor in your hand. Once tardive dyskinesia starts, it can become permanent. So you have a permanent facial movements and twitches in your arms and in your body that are irreversible after a certain point. So a lot of psychiatrists don't like using the older antipsychotics like Haldol, but I am on Haldol, and I haven't developed tardive dyskinesia, and if I did, my psychiatrist would stop prescribing them. But I'm also on the newer antipsychotics, like Seroquel, which doesn't have all those dangerous side effects that you have with the original antipsychotic or typical psychotic antipsychotic drugs. Um, there are other drugs like for anxiety, for example, that don't fit into benzodiazepine tranquilizers. Um, I'm personally taking Neurontin, which is used for many things, but in my case, we're using it for anxiety and akathisia. Akathisia is just the feeling that you need to move constantly and you can't sit still and you end up pacing back and forth. That too can be a side effect of older antipsychotics, but we got that under control with Neurontin. Neurontin is a drug used for nerve pain and pain in a lot of different disorders. I believe it's used is prescribed to avoid migraine headaches, but in my case, it's for anxiety and as an anti-anxiety agent that works over time and is helpful with my akathisia, my anxiety, and my insomnia, and I'm able to sit still better. Um, Another antipsychotic drug called Buspar um, is not a benzodiazepine tranquilizer. You take it for anxiety, and it's not addictive, and it takes a while, like a week to 4 weeks, before it gets into full effect in helping control anxiety. And other drugs that you use for anxiety are antihistamines like Benadryl and Atarax. I take Atarax because it's not addictive. It's basically just an antihistamine, and it can also be prescribed for anxiety, and I take it for anxiety. And it's not addictive or going through bad withdrawals when you stop, like Valium, Librium, Xanax, and Klonopin. Um, there are other drugs. I take a blood pressure medication to control tremors in my hands caused by my psychiatric drugs. It's usually used as a beta blocker blood pressure medicine, but it's also good for anxiety and the tremors that I get in my hands from the Haldol. So that's about everything that I wanted to talk to you about today. If you have any questions about your specific medications, please ask your psychiatrist, your pharmacist, your doctor, or other healthcare professional. And like, subscribe, share, comment,